everyone, my name is Catherine Sofel. I am a registered dietitian with a master's degree in nutrition as well. And today I will be going over fluids and hydration, specifically those who are in the long-term care facility or assisted living facilities. So today's objectives, we're going to go over some background information, discuss the body's hydration needs in older adults because they do change as we age. We're going to discuss the signs and symptoms of dehydration, the complications associated with dehydration, and identify some strategies to help maintain adequate hydration and reduce, the risk of dehydration. We're also going to touch a little bit on fluid, fiber, and constipation because they do go hand in hand. And then last but not least, we will discuss some fluid restriction because some patients are required to be on a fluid restriction, so we'll kind of go over that a little bit as well. So water in the human body, as I mentioned earlier, our water needs change as we age. So earlier on in the beginning of our early years, so infant to 1 year old, the human body is made up of about 86% water. So it has a large volume of water, as newborns and, babies up until 1 year old, their body is made up of. As we begin to age, years 5 to 14, the amount of water in the body decreases slightly to about 75%. And then by age 20 to 35, the amount of the body is going to be 65%. And then between ages 40 to 50 starts to decrease more. 55% of the body is made up of water. And then by the age 60 to 80 years old, about 50% of the body is made up of water. So the amount of fluid is going to change depending on the person's age and how much fluid they need to consume on a daily basis. But just to have a general understanding of the human body and the fluid amount in the human body itself. So the thirst mechanism is going to be determinant of a couple of different factors. And in healthy individuals, the normal sensation of thirst promotes the consumption of adequate fluids to maintain hydration. So if you can think about times when you are thirsty, you have that sensation to want to drink fluids because you feel thirst. And this can be determined by several factors within the body. So these 8 things typically are what is going to influence this thirst mechanism in the body and to prompt you to want to drink fluid. So the plasma osmolality, which is plasma is going to be the blood. So your thirst mechanism is going to be based off of the osmolality of the blood. So if the blood has a lot of fluid in it, then that thirst mechanism may not be there. But if the osmolality is high, then it may prompt you to consume water to kind of even out the osmolality in the blood or the amount of particles in the blood. Low blood volume is also going to increase that thirst mechanism as well in order to increase the blood volume within the body. And then low blood pressure can also make a person want to drink more and promote the intake of fluids as well if the blood pressure is low. Climate is going to have a determining factor that kind of goes along with temperature and humidity. So the hotter it is outside, especially here in Florida, if this is where you guys are residing, temperatures outside are much hotter than they are in the northern parts of the country. So with that being said, most people are going to be wanting to drink more water in the heat compared to the cold. Humidity is going to determine the thirst mechanism. And then our body has, different hormones that take place that's also going to either increase the thirst mechanism or decrease the thirst mechanism. And then last but not least, medications will play a role. So it kind of goes along, depending on a patient's medications that they take, it can either increase their thirst mechanism and promotion to consume adequate fluids, or it can, make them not as thirsty. So in older adults, the elderly population is at an increased risk for dehydration. And this is kind of defined as a reduction in total body water volume and defined as a significant loss of 3% of body weight. So dehydration is going to be defined of a loss of body fluid, 3% of loss of fluid. And it can also be accompanied by some biochemical changes and clinical features within an individual's body. So oftentimes older adults, the reason why they are at an increased risk of dehydration is because as we age, this thirst sensation is decreased. So individuals or older adults don't get that prompt that a younger individual would get in order to consume liquids for hydration purposes. There's also a decreased renal perfusion, so the renal or your kidneys are what kind of helps fluctuate the amount of fluid that is being retained or urinated. So in older adults, as we age, our organs don't work as properly. So the renal system may not work properly, and so this can affect the amount of fluid or the amount of total body volume or water volume that's inside the body. And older adults who are on antidiuretic hormones or medications, so the diuretic hormone is going to be something that increases the amount of water that is lost through urine, and so older individuals, again, just through the aging process, may have an altered sensitivity to this type of hormone. And then neurocognitive deficits can also, be seen as a clinical feature with dehydration. So again, as I mentioned, the reason for dehydration in older adults is going to be due to this decreased thirst sensation. And the prevalence of dehydration in institutional care facilities such as long-term care facilities or assisted living facilities. So some studies have shown that about 98% of residents consume less than the daily recommended fluid intake. So that is a large amount of residents that are not consuming the proper amount of fluids. And in assisted living facilities and long-term care facilities specifically, it was found that about 31% of residents experience dehydration over a 6-month time period. So if you're looking at a population of individuals within a care facility, within that 6-month time period, 31% of residents could be dehydrated, which again is a pretty high number in such a short period of time. And cognitively impaired residents in nursing facilities are at the highest risk of dehydration, and more than 1/3 of them do suffer from dehydration. So here we have a total amount of 98% of residents who are consuming inadequate fluid intake, and individuals who are cognitively impaired, about 1/3 of those will suffer from dehydration. So pretty big numbers, and definitely something to be aware of if you are taking care of individuals in nursing facilities, to be aware of the high risk of dehydration that can accompany patients in general. So the amount of fluid in the body is going to kind of fluctuate, but approximately daily values of fluid is going to be based off of the input and output. So our input of fluid is going to be how much you drink per day. Typically, the average person is going to drink about 1,500 milliliters per day of fluid, and about 500 milliliters of fluid is going to come from the food that we consume. So food does have fluid, fruits, vegetables, or anything that may be cooked in fluid is going to be counted as fluid. And then the metabolism process in general does create some bit of fluid within the body. So that kind of is a representation about an average 250 milliliters per day of fluids. Well, actually, these numbers are 2,000 milliliters, but I'm sure there are some other factors such as saliva input. You actually do create a lot of saliva in your mouth that is going to contribute towards that fluid technically that your body is producing. And then the output is going to be typically what you consume, you output. So about 1,500 milliliters of fluid, urine output per day. And then there's also a loss of fluid from insensible loss. So those are things such as when you sweat, you lose water, your lungs, the act of breathing, so your respiratory, every time you breathe in and out, you're losing a little bit of water particles through your respiratory function. And then your feces also are going to contribute to some fluid loss. So about a total of 250 milliliters. So ideally we want these numbers to be even. If we are outputting 250 milliliters, then we want our total input of all of the mechanisms together to equal the same amount. If our total input is less than our output, then this is what happens when we become dehydrated. So we're not consuming enough fluid in order to account for the loss that happens. So dehydration can be caused by excess fluid loss from the body, and it can be due to illness, high temperatures, inadequate fluid intake, and diuretic medications. So diuretic medications are medications that cause individuals to urinate more, so their output is going to be higher than someone who's not on diuretic medications. And these four things combined together can cause a total decrease in body fluid. So this is how we have those uneven numbers from total output to total input, and this can, increase the risk of dehydration when we have a greater loss of water from the body. So the risk factors for dehydration, we have poor appetite. So individuals who are, consuming less food and water in general are going to be an increased risk for reduced amount of fluid intake. Dysphagia, so swallowing difficulties. If you have watched the other presentation about swallowing difficulties, if an individual, does have swallowing difficulties, this may impair their ability to consume fluid or food in general. And specifically, if an individual is on a thickened liquid diet, so if they're not able to consume regular thin liquids and their drinks have to be thickened, it's going to decrease the total amount of water that they're consuming, most likely. And then reduced ability to self-feed. So whereas, someone who is able to eat and drink on their own, they don't have to wait on someone to feed or drink them or to give them a drink. So someone who, is not able to pick up a glass of water and drink it, doesn't have that ability, they are definitely at an increased risk for dehydration because they are having to rely on someone then to always think about, giving them water. Even though they may have that thirst mechanism, if they're not able to consume fluid or food by themselves, then this is going to increase their risk for dehydration. Diarrhea is also going to be a risk factor, so excessive loss of fluid through feces can increase the total volume loss from the body. Vomiting as well. And laxative use. So laxative use can be used that more than likely is going to be a cause of diarrhea, so that just adds to the amount of fluid that is lost. And like I said, diuretic use, so medications that increase the amount of water that is lost or urinated can increase the risk of dehydration. And polypharmacy, so individuals who, it has been shown that individuals who are on 4 or more medications are going to be at an increased risk for dehydration. Some other risk factors are increased respiratory rate. So as I had mentioned earlier, one way that you lose fluid from the body is through your respiration. So every time you breathe in and out, you're losing water molecules through your breath. So if someone is short of breath often, or they have a high respiratory rate, if they're breathing in and out very, very quickly or more rapidly than normal, then they're losing more of those water molecules through respiratory function. And incontinence, so individuals who are not able to control, when they urinate, then they may be consuming less liquids because they don't want to wet the bed or any type of situation like that. So in general, it can cause a fear and not wanting to drink fluids for that reason alone. And polyuria. So polyuria is excessive urine. So individuals who have uncontrolled diabetes, the reason why they urinate more is because they have a lot of blood sugar in their blood. And so when this is filtered by the kidneys, it wants the kidneys are trying to get rid of the extra glucose, and so in order to do so, it needs to get rid of the extra fluid in the body as well. So not uncommon for patients who have uncontrolled diabetes or very high blood sugars all the time to have increased urine and a risk factor for dehydration. Individuals with cognitive delays, so again, that thirst mechanism may be diminished. So they may not have the ability to recognize that I'm thirsty or that my body needs fluid, so they are at an increased risk for consuming less fluids. Comprehension or communication disorders kind of go hand in hand with the cognitive delays, unable to recognize that thirst mechanism or unable to communicate that they are thirsty if there's no fluids around them. And then dementia patients kind of goes along with the cognitive delay as well. The thirst and food mechanism is definitely going to be decreased in dementia patients, so they don't have the ability normally to recognize that they are thirsty or that their body is doesn't have enough fluid within it. And then individuals who are immobile may also be at a higher risk factor for dehydration just for decreased fluid intake. And then obesity individuals, because obese individuals technically will need more water because they have a bigger mass and a bigger body size. So all of their cells, even their fat cells, need additional fluid and water. And so in this case, obese people can be at a risk factor for dehydration because they need more water consumption for their body size overall. So specific risk factors that are important to look out for and to kind of help identify the patients who are going to be at a greater risk are going to be female. So for whatever reason, I don't know exactly, but females or older individuals specifically are known to have a higher risk for dehydration, and this could be along with the diminished thirst recognition. And then individuals who are greater than 85 years old. So many reasons why cognitive delays or dementia is going to be greater in individuals who are 85 years old. And then again, as we age, our thirst mechanism is going to be, decreased more and more. So the older we get, the less ability our body has to be able to recognize that thirst mechanism. And then individuals who have 4 or more chronic conditions are going to be at a high risk of dehydration. And anyone, again, who is on 4 or more medications, so that polypharmacy of 4 or more medications. Likely that one of them is going to be a laxative that's going to increase dehydration. One of them may be a diuretic hormone that can increase dehydration. And then individuals who are bedridden, so they may not have access to fluid all the time or have it available at bedside, or again, if they are unable to, use the restroom or by themselves, then they may be more likely to drink less water in order to avoid having to be cleaned up or need to be changed. So some additional risk factors that have to do with, staffing members within assisted living facilities or long-term care facilities is that individuals need to have the appropriate, facilities need to have the appropriately skilled staff to assist residents and to be able to identify risk factors, to be able to identify the signs and symptoms of dehydration. So risk factors for dehydration is going to be inadequate staffing. So if there's not enough staffing to be able to go around to do rounds, to provide individuals fluid or the care that they need, the risk of dehydration in patients is going to be higher. Lack of assessment. So if an individual is taking care of, an elderly patient and they don't do a thorough assessment on that patient to, monitor their intake or do the physical exam purposes to be able to monitor for risk of dehydration, then that's a risk factor as well. And then having disregard to personal or cultural preferences. So this can be, a patient's fluid of choice, whether they have, asked several times not to have X fluid, but they keep receiving this fluid. So they may be less likely to drink a fluid if they aren't, don't like that fluid in general. So important to pay attention to, the drink choices that a patient is asking for in order to, help reduce the risk of dehydration. So the signs and symptoms of dehydration, several of them. So the first one is going to be thirst. So in normal individuals, when we feel dehydrated, we have this thirst mechanism that is triggered. So if an individual is saying that they're thirsty, then this could be, prolonged thirst could be a sign of dehydration. Someone who is complaining of a headache could also have dehydration. Sunken eyeballs, so when the eyes kind of go inwards and they're kind of sunken into the sockets, that can be a sign of dehydration. a swollen tongue, and then decreased urination. So if you're consuming less fluids overall, then you're going to be outputting less fluids too. So someone who is, not urinating very frequently or very much, that could be a risk of or a sign of dehydration. Kind of alluding to that they're not consuming enough fluids for an adequate amount of urine output. And then if an individual is complaining of fatigue or muscle weakness, being dehydrated and not have enough fluid in the body can contribute to this. Decreased skin turgor, which I will show you a description, but it's kind of an easy test to tell how hydrated an individual is. And then having dark colored urine. So important, to monitor at-risk patients for the color of their urine. The darker the color of the urine, the less fluid that is being outputted in the urine. And so a light colored urine is going to indicate plenty of fluid. Weight loss. So again, that 3% weight loss from their usual body weight or from the most current weight could be a sign of dehydration if they've lost fluid in general. And then decreased functional ability. So someone who's very lethargic, not able to get up, and normally they are able to. So this could be a sign and symptom of dehydration. So all very important things to watch out for and monitor. So skin turgor is a sign to tell if someone is dehydrated. So decreased skin turgor means that the skin, when you pull it up, it remains pulled up and released. So as you can see from this picture here, this is going to be a sign of dehydration. Normally, if you were to pull your skin up and pinch it, let's see, it's going to go back to normal. So there's no sign of dehydration. But in an individual with dehydration, that skin is going to stay up, remain maybe for a couple seconds, just depends on how dehydrated they are. So this is a very good test to do on patients, if there is a concern for dehydration. And then on the right hand side here, we have a picture of the urine. So very good urine is actually pretty clear, which is ideally what individuals' urine should look like. This shows very good hydration, consuming plenty of fluid. And then as we, consume less and less fluid, the amount of urine that we are excreting becomes less and less. And so when that happens, the urine becomes more concentrated, and so it's going to be darker in color. So see at the bottom here, we have severe dehydration. So definitely a good sign to watch out for and monitor the color of residents' urine if you're able to, in order to tell, their hydration status, especially in individuals who are going to be at an increased risk, or again, just another good sign to be able to identify. The complications of dehydration. So a loss as little as 2 to 3% of body fluid can cause physical and cognitive impairment in individuals. So dehydration is a major predictor of morbidity and mortality in patients admitted to the hospital. I would say I see this a lot from patients coming, especially, your elderly patients who come to the hospital here where I work. Major risk factor. Many times a lot of patients are, dehydrated. So they're very lethargic. Their blood kind of shows that they're dehydrated with their lab levels. So definitely important to monitor for dehydration in the early stages so that it doesn't cause, these cognitive impairments and, lethargy and stuff like that. And some additional consequences of dehydration. So constipation can be a cause if there's not enough fluid going in. Then when we try to, produce stool, it could be too hard or too tough, not having enough fluid within the bowels. Mucosal dryness. So this is dry mouth and dry eyes. Again, not enough fluid in the body to help, lubricate the eyes and the mouth. Nausea and vomiting can also be a consequence of dehydration, and this is going to be most likely due to the electrolyte balances that can occur. Decreased urinary output, elevated body temperatures. Someone who's dehydrated could have, a fever. And then again, these electrolyte disturbances, which if they go, untreated, especially having high sodium in the blood, which can happen from dehydration, it can be very detrimental to patients. And then, having altered other electrolytes can cause seizures and all types of manifestations. And because of the decreased urinary output and the more concentrated the urine is when someone is dehydrated, this can increase the risk of urinary tract infections. It can also cause seizures, again with the change in the blood chemistry and having high sodium. It can cause mental confusion, hypotension, so low blood pressure. It can cause hypovolemic shock. So hypovolemic shock is when the body has not enough fluid in order to pump through all of the body organs and to keep them sustained. So someone can go into shock from not having enough fluid to circulate throughout the body. And then acute renal failure. So the kidneys have inadequate fluid that is filtering through them. Same thing with the shock, and they eventually start to fail because there's not enough fluid to be circulated through them. So the recommended fluid intake for individuals, there are a couple different mechanisms, and this isn't something you necessarily need to know, but just so you have an idea of where we come up with these numbers. So one of the methods is 1 milliliter per calorie. So most individuals will have amount of calories that's going to be calculated, and that would match the milliliters of fluid is going to match that amount of calories. So let's say that an individual should consume 1,800 calories. Well, their fluid intake should be around 1,800 milliliters. And then there are some additional calculations. So for individuals who are less than 50 years old, you would use 1,500 milliliters. And basically what you would do is take their body weight. So let's say that they are 60 kilograms in weight. You would subtract 20 from that. So now you have 40 kilograms, and you multiply that by 20 milliliters, and then you add 1,500 to that. And then there's a different mechanism as well for individuals who are over the age of 50. And then the third or fourth method is going to be adults who are, or older adults who are between the ages of 56 and 65, 30 milliliters per kilogram of body weight. And then older adults who are greater than 65, it would be 30 to 35 milliliters per kilogram of body weight. But again, not anything calculations that you would need to know specifically. And just in general, some general guidelines of fluid requirements is going to be around that 1,500 milliliters or 1.5 liters per day minimum on average, and this is equivalent to about 6 to 8 glasses of 8-ounce fluids per day. So an 8-ounce cup is going to be about this much, so 6 to 8 of those per day. So this is just a description of some different fluid volumes per the type of cup. So I had mentioned earlier, just previously, that 1,500 is typically the total volume recommendations for the day. So one small wine glass is going to be 120 milliliters, another small glass 140, a teacup or a coffee cup 150 milliliters, a large glass 180, a regular mug 200, a tall mug 250, and then a pint is 500 milliliters. So just so you have a little bit of an understanding of how much total fluid is in each cup. And then these are some fluid contents that you may see on trays, depending on the facility is going to vary between each facility, but typically these are the total fluid amounts that you will see. So breakfast, normally if juice is served, it's going to be a 120 milliliter amount. Milk is going to be that 8 ounces, which is 240 milliliters. Coffee is going to be 180 milliliters. And then some water, 240, and so on and so forth. So really, at the end of the day, an individual may have been served 2,100 milliliters for the whole day. So strategies to maintain and increase fluid intake. If an individual is at risk for dehydration or they are not consuming enough fluids, then these are some strategies to help increase that fluid intake. So first, ensuring that all staff are adequately trained on the importance of hydration, not only the importance of dehydration, but the signs and symptoms that we had talked about in order to, assess a patient's risk factors for dehydration, who is most at risk, and then the signs and symptoms. So again, that decreased skin turgor, dark colored urine, lethargy, stuff like that. And then regularly offer fluid. So especially to individuals who are struggling to maintain fluid intake, offering them fluid, every 1.5 hours, and in hopes and just encouraging them to try to drink. Even a couple sips every so often is better than nothing. So the more you offer fluids, the more likely they are to drink them. And then offer fluids at specific routine events, such as before and after showering or washing after the toilet, before and after physiotherapy or any other activity program, and then during medication rounds as well. Regular hydration carts, so whether you have a cart that goes around that has different types of water, juice, any other types of fluid that you can just offer to patients or residents and have them choose which fluid they would like. And then offer residents their preferred drink choice as well, so asking whether they want water, tea, coffee, lemonade, any type of fluid, making sure that they are getting their preferred drink choice. And then prompting residents to drink at meals as well. So, when they're sitting in the dining hall or wherever they may be eating, encouraging them to drink their fluid along with their meal, and that will help increase their fluid intake. Ensure fluid is within residents' reach. So if a resident is sitting in a chair, in their bed, always having some sort of fluid available within arm's reach so that they can easily access it. So if it is, in the fridge or at the counter or not within their reach, they're going to be less likely to consume it if it is out of their sight. And then if families and visitors come to visit, encourage them and educate them to offer fluids when visiting as well. So normally residents are more likely to consume food and drink when they are comfortable, and typically they're going to be comfortable around people they know, such as their families and visitors. So using that time when they do have visitors to offer fluid is going to be important. And then if a resident is, just has very little fluid intake, you can offer wet foods that do have fluid in them to help increase that intake. So things like jello, custard, ice cream, soups, and pureed fruits are going to have a higher water content, so those things should be offered in addition if fluid intake is low. And then having a social hour where fluids are offered, so any type of group activity or event, always having fluids there and offering them. And having a fluid chart for residents who are at high risk. So if there is a resident who has been dehydrated before or has a history of it, keeping a chart available and to kind of mark down, how much fluid did they drink at breakfast, how much fluid did they drink at their snack, and to kind of be able to keep track of it, so that way you can track it better and be able to identify, if they are just consuming far too little. And then using a symbol such as a water drop on trays in order to, prompt the staff to encourage them to consume fluid. So residents who are at an increased risk, they may need more additional reminders and prompts. So having a water tray or a water droplet picture would be helpful. And then being able to identify at-risk patients and pay more attention to them. So individuals who are confused at baseline, who are refusing fluids, may have a fever, and then those who are on diuretics need to be, paid close attention to for their overall fluid intake and kind of monitor that. So some special circumstances, gastroenteritis. So gastroenteritis is like the stomach flu. Basically, it can come in the form of nausea, vomiting, diarrhea, or a mix of both. So it's just the stomach bug. However, it is pretty common in nursing home facilities and other residential facilities and can be pretty frequent. So it is one of the most challenging illnesses for the risk of dehydration. As I mentioned earlier, you lose fluid or more fluid through vomiting and diarrhea. So the increased risk of fluid loss can contribute to a risk factor for dehydration. And this is vomiting and diarrhea also increases the loss of fluid and the loss of electrolytes, again, which can be detrimental. So for replacement fluids, such as lemonade is not going to be very beneficial, because it's not going to be the fluid that you're consuming along, within that drink mixture is not going to be absorbed as rapidly because it is too sugary. And then fluids with no sugar or electrolytes can actually increase the loss of fluid through diarrhea or through the gut. So the best form of treatments for gastroenteritis and encouraging fluid intake is going to be with fluids that have glucose and salt. So specifically Gatorade is going to be beneficial for ensuring the rapid absorption of water and the electrolytes within the bowel. And it's important to use these replacement fluids early on, so from the beginning of an episode of gastroenteritis, as early as possible, offer a little bit of fluids, and then try to offer some fluids, frequently in order to reduce the risk of dehydration as well. So next we are going to get into fluid, fiber, and constipation in older adults. So constipation is common in the general population, and it actually increases with age. So individuals who are over the age of 65 years old, 26% of these individuals may experience constipation in women, and then 16% of men over the age of 65 years old also experience constipation. As that number, or as that age increases, the risk is going to increase. So in individuals over the age of 85, 34% of women experience constipation, and then 26% of men over the age of 85 years old also experience constipation. So in long-term care or assisted living facilities, the prevalence of constipation can be as high as 80%. So definitely an important factor to be conscientious of when taking care of patients or residents. So the actual diagnosis is going to be diagnosed with 2 or more signs. So it is going to be straining during bowel movements, hard or lumpy stools, and then or a sense of residents complaining of a sense of incomplete evacuation, the need for manual maneuvers, or someone who has fewer than 3 bowel movements per week. So in order to officially diagnose constipation, someone would need to have 2 or more of these signs. Complications of chronic constipation can be swollen veins or hemorrhoids, and this can be caused by straining that causes swelling of the veins. It can be an individual can have a torn skin or a fissure. So when a large or hard stool, it can cause a tiny tear in the anus. And then fecal impaction. So stool that cannot be expelled may cause an accumulation of hardened stools that get stuck in the intestines, and this can be very dangerous. And then rectal prolapse. So the intestines begin then to protrude from the anus itself. So these signs and symptoms of constipation are going to be the feeling of fullness, bloating, or pain in the belly region. And this is obviously due to a buildup then of fecal matter within the stomach. And, if there is a buildup, then food that is from our stomach that goes through our intestines is going to be going much slowly because there's a blockage, or there's nothing that is, moving through the digestive tract. Individuals probably will have a poor appetite as well. And most older adults are able to admit to the symptoms of constipation when asked. However, a person with Alzheimer's or any other related dementia, they may not be able to remember or communicate these symptoms or communicate, what's going on. This is going to be true for anyone with any type of, cognitive delay. They may not be able to communicate that they are constipated. And if they are constipated, then they may act out or become more irritable if they're constipated, if they're not able to kind of relay what's going on. So the causes of constipation in older adults, it can be, multifactorial. It can be due to multiple causes and risk factors. One of them that I'll get into is going to be medication side effects, insufficient dietary fiber intake, insufficient fluid intake, which we've gone over, electrolyte balances, endocrine disorders, or a disorder called hypothyroidism can also be a cause of constipation. And then immobility or low physical exercise. So an individual who is immobile, who is bedridden, or anyone in general who has low physical exercise, their movement of the gastrointestinal tract is going to be slowed. So this can be a risk factor or a cause. So some additional causes are going to be slow transit due to chronic nerve dysfunction. So someone maybe with a history of a stroke or any other type of nerve dysfunction, that ability, for the GI tract to function properly may be impaired. Neurological conditions such as Parkinson's disease can impact the nerve and cause dysfunction. And then irritable bowel syndrome is also going to be another cause of constipation. Pelvic floor dysfunction, and then any other type of psychological factor. So when we have anxiety or depression, both of these things can manifest themselves in different ways. And so one of them may be, decreased nerve function. And then again, very low levels of physical activity. So the medications that are important to be aware of that can be associated with constipation are going to be anticholinergics. So these are sedating medicines. Also medications that are used for overactive bladder, muscle relaxants, and then anti-nausea medications can also be a risk factor for constipation. Opiate painkillers such as codeine, morphine, and oxycodone, they actually slow the GI transit and can cause constipation. Diuretics, because you are losing more fluid through urine, and so there's going to be a lower volume of fluid within the body to help aid with the digestive tract. And then some calcium supplements can also cause constipation, and then iron supplements as well. So, when a patient or a resident, does have chronic constipation, it may be important just to kind of be aware of any medications that could be associated with it. And the second thing that can be a risk factor or a cause of constipation is going to be inadequate fiber intake. So the recommended amount of fiber intake per day is about 20 to 25 grams. I would say most individuals consume far less than this amount, which is why constipation is actually such a large issue. And inadequate fiber and fluid intake can cause constipation because dietary fiber or fibrous foods, they increase the size of your stool, but they also make them softer. So both of these things combined will help to increase the transit time through the digestive tract, and obviously then being softer, it is more easily passed. So larger, softer stools help keep people regular, and then they move through the bowels faster, and then they are easier to pass. So there are some different types of fiber. You have insoluble fiber, and these types of foods are going to be wheat bran, vegetables, and whole grains. And then you have soluble fiber, so oat bran, nuts, seeds, lentils, fruits, and vegetables. So some overlapping type, most, as you can see, some overlapping foods. So for instance, oatmeal has a combination of both insoluble and soluble fiber. So a lot of foods do have a combination of both of these types of fibers. And just some examples. So you have sweet potato, avocado, black beans, oatmeal, tofu, oranges. Looks like some other type of bean here. Chickpeas. Oh, these are lentils. Apple. This is going to be oats as well. Almonds, beans. So lots of fruits, vegetables, whole grains are going to be, the highest amount, and beans are going to be the most foods that have the most amount of fiber. So it is important to make sure that, if an individual does have a history of constipation or is constipated, or just in general, that there is enough time and attention given to periods of time when our gut motility is highest. So toilet facilities should be, readily accessible and used or encouraged use after meals. So our gut motility is highest after we eat, after first thing in the morning, and or at any other, everyone is different, but those are going to be the two most typical times that bowel movements happen. So having, toilet facilities available during those times is going to be important. And then encouraging physical activity. So bowel motility can be improved with exercise, walking, or whatever type of physical activity is possible. And physical activity should be encouraged during periods of high gut motility, such as after meals or first thing in the morning. So lastly, I will get into fluid restriction. As I mentioned, some individuals will be on a fluid restriction, and so the total amount of fluid that is recommended may not be the same. So fluid could be restricted in a resident with certain medical conditions such as heart failure, ascites, which is a buildup of fluid in the abdomen, an individual who is end-stage renal disease, or any other type of disorders that can cause a fluid retention. So all of these disorders are fluid retention causing disorders, and so what we don't want is to give excess fluids to individuals who are not able to properly get rid of fluid or have fluid accumulation problems. So the signs of fluid overload, to be able to identify them, is going to be an increased weight. So someone who is holding on to water weight, their weight is going to go up. They may have swollen or puffy eyes, moist skin, pitting edema, swollen ankles, feet, and sacrum. And then you can have distended peripheral or neck veins as well. So, there's just a lot of blood or a lot of fluid in the blood, so kind of bulging of those veins. And then the most dangerous, types of signs are going to be shortness of breath, dyspnea, and lung crackle. So all of these things are associated with excess fluid around the lungs, which can be very, very dangerous. So if these things are prevalent or identified, then it's very important that they are sought help. And this is just a picture of edema, what it looks like. So in a patient without edema, it looks completely normal. And then with edema here, what's known as pitting edema, if you put your finger and you press it, it literally sinks in. And then even when you release your finger, you can still see this indentation on the leg. So this is a sign that there is excess fluid around the legs. And typically fluid is accumulated in our peripherals, or specifically our legs, because of gravity. So very easily identified if someone is fluid overload by looking at their feet. And then over here on the right hand side, swollen or puffy eye. So fluid has accumulated around the eyes or around the orbitals. So both signs of fluid overload. So now we are going to get into the question and answers. The first question is, which of the following best describes the thirst mechanism related to older adults? We have A, the sensation of thirst to promote the consumption of fluids and increases in older adults. B, the sensation of thirst to promote the consumption of food, and this decreases in older adults. C, the sensation of thirst to promote the consumption of fluid and decreases in older adults. And then D, the sensation of thirst to promote the consumption of fluids and does not change as we age. So the answer here is C, the sensation of thirst. So thirst mechanism is the sensation of thirst to promote the consumption of fluids, and this mechanism decreases in older adults. Number 2, a decreased thirst mechanism is the main cause of what in older adults? A, dehydration, B, elevated body temperature, C, low blood pressure, or D, none of the above. So the answer is A, dehydration. So that thirst mechanism that decreases as we age and we're in older adults is going to be a major factor for the risk of dehydration. Number 3, what are the risk factors for dehydration? Select all that apply. So A, poor appetite and dysphagia or swallowing difficulties. B, diarrhea and vomiting. C, dementia and cognitively delayed residents. And D, the use of diuretic medicine or polypharmacy, or that more than 4 medications per day. And the answer is all of the above. So all of these risk factors or all of these components are going to be a risk factor for increasing the risk for dehydration. So again, poor appetite, if someone is not eating or drinking, or not eating, they're probably not going to be drinking much fluid. And then dysphagia, that difficulty swallowing, can impair the amount of total food and fluid that they're consuming. Diarrhea and vomiting is going to increase the amount of fluid lost from the body. And then dementia, individuals with dementia or cognitively delayed may not be able to relay or understand that they or have that thirst mechanism available to them, and to be able to relay that they are thirsty. And then lastly, the diuretic use, so that's going to increase the amount of fluid that is lost from the body through medication. And then an individual who consumes 4 or who takes 4 or more medications is also going to be at an increased risk. Question 4, what is the best fluid to offer a resident with gastroenteritis, also known as the stomach bug, so having vomiting or diarrhea? A is going to be water, B, Gatorade, C, lemonade, or D, coffee. So the answer is B, Gatorade. This is going to be the best fluid to offer because it has both salt and a little bit of sugar in it. So this is going to help increase the absorption in the large intestine of the water and help to, rehydrate an individual as best as possible. Number 5, which is not a sign of dehydration? We have A, weight gain. B, decreased skin turgor. C, dark colored urine. Or D, fatigue or altered mental status. The answer is A, weight gain. So weight gain is not a sign of dehydration. It's actually the opposite. Weight loss can be a sign of dehydration. But the other signs of dehydration are going to be that decreased skin turgor. So the skin test, if their skin stays up more than usual, then that can be a sign. Dark colored urine, and then anyone who might have a new onset fatigue or altered mental status could all be signs of dehydration. Number 6, what is the average recommended fluid intake per day? A, 500 milliliters, B, 1,000 milliliters, C, 1,500 milliliters, or D, 2,000 milliliters. So the answer is C, 1,500 milliliters. This is going to be the average daily minimal amount of fluid intake recommended per person or per day. Number 7, how can staff help ensure residents consume adequate fluids? Select all that apply. A, encourage fluid intake at each meal. B, offer wet foods such as jello, custard, puddings, soups, pureed fruit, and ice cream. C, keep a fluid chart for at-risk patients. D, offer fluids every 1.5 hours during the day. And the answer is all of the above. So all 4 of these ideas is going to be an important or a beneficial one to perform in order to make sure that residents are consuming enough fluid. Number 8, which of the following is not a risk factor for constipation? A, inadequate fluid intake. B, inadequate fiber intake. C, medication side effects. Or D, regular physical activity or exercise. So the answer is D, regular physical activity or exercise is not a risk factor for dehydration. It's actually the opposite. So individuals who have a low physical activity or a low physical activity or exercise are going to be at an increased risk for dehydration because the motility is not as high as it would be. And then the other risk factors for dehydration are going to, for constipation, inadequate fluid intake, fiber intake, and then some medication side effects. 9, which of the following foods is not high in fiber and is not beneficial for preventing constipation? A, apple. B, eggs. C, oatmeal. Or D, broccoli. So the answer is eggs. B, eggs. Eggs do not have any fiber in them, so therefore they would not be a food that would be beneficial for preventing constipation. However, apples, oatmeal, and broccoli all have plenty of fiber in them, so those foods would want to be, consumed in order to prevent constipation. Last but not least, number 10, which of the following is not a sign of fluid overload? Well, we've got them right here. A, weight gain. B, edema. C, dry skin. D, shortness of breath and lung crackles. So the answer is going to be C, dry skin. Dry skin would actually be a sign of dehydration. A sign of fluid overload for the skin would be to have moist skin. So all of these, weight gain, edema, shortness of breath, these are going to be signs of fluid overload. Whereas dry skin would be a sign of dehydration. So that concludes today's presentation. Thank you so much, and I hope you have a wonderful day. Bye.